Today, we're going to be diving into long COVID, a condition that is affecting millions of people across the world. And it's something that is complex, that includes a range of symptoms of everything from fatigue, brain fog, dizziness, cardiovascular symptoms like rapid heart rate, palpitations, shortness of breath, and even unexplained pain and inflammation. The problem with long COVID or any post-viral syndrome is that inflammation doesn't resolve. And today we're going to unpack why this condition is ravaging so many people and what you can do about it. The Neurotrition Podcast is sponsored by North Florida Spine and Wellness and produced by Juming Delmas Studios. Welcome to another episode of the Neurotrition Podcast. I am your host, Dr. Z, and today we're going to be diving into long COVID, a condition that is affecting millions of people across the world. And it's something that is complex, that includes a range of symptoms of everything from fatigue, brain fog, dizziness, cardiovascular symptoms like rapid heart rate, palpitations, shortness of breath, and even unexplained pain and inflammation. And today we're going to unpack why this condition is ravaging so many people and what you can do about it. Don't forget to like and subscribe and follow us at Neurotrition Podcast on Instagram, Facebook, TikTok, and YouTube. And welcome to the show. So, long COVID is probably a term you've heard quite a bit over the last few years since the pandemic hit. I think the first thing to talk about is what is long COVID in of itself. And essentially, it's a group of symptoms that happen post either a COVID uh, infection, or we also see it sometimes post vaccination. Sometimes we see a combination of these two events happen. It's oftentimes we see patients who have had a COVID vaccine and then get infected very shortly afterwards. It's not really important why you developed long COVID. The question is, what do you do to get it better? As of now, this has been a very recognized condition throughout the medical community. The problem is there hasn't been a lot of real solutions to help people recover from the symptoms that they're suffering from. And it's funny for me as someone who has done uh, functional medicine for quite a while now, is that this is something that we have seen in a lot of patients over a long time, well before COVID came onto the landscape. And it essentially comes down to a post viral infection. So sometimes when people get infected with a virus, and it doesn't have to be COVID, COVID has been very unique, that's for sure, and has created some interesting challenges and has led us to go down different treatment protocols because of the uniqueness of this virus. But essentially, a post-viral syndrome is when the body their immune system keeps reacting. So when you get infected with a virus, the immune system comes in and it's going to do its job to fight that virus, create an inflammatory response to that virus to help quell it and get it out of out of the system. A lot of people talk about, well, inflammation is bad. Well, inflammation is good when it's there in the right context, particularly when we're fighting some sort of viral infection or bacterial infection or anything like that, when the body has to create a healing response. The problem with long COVID or any post viral syndrome is that inflammation doesn't resolve. And so when that inflammation doesn't resolve, we got to start thinking about why that is. And with long COVID, it actually goes over a variety of different systems within the body. You know, One thing that I've noticed is that no two people with long COVID are quite the same, especially with symptomatology, because it affects these different systems. Some people, it's purely cognitive related. They complain of brain fog. Some people, it's more um, physical, where they just feel uh, unrelenting fatigue, for instance. Some people, it's all chronic digestive issues. For some people, it's just shortness of breath. They can't seem to get that respiratory function back. And so the treatment for these things, while they can vary of where we need to focus our approach, they do tend to be kind of interrelated, essentially. And so I think it makes sense for us to kind of dive into where, what COVID does and where it's going to most likely attack these different systems. So then you get a better idea of how to address these symptoms and the condition at large. So, for the sake of simplicity, I want to break this down into three major areas that COVID tends to impact people the most. One is going to be immune dysfunction and inflammation. So essentially, when we get sick, the immune system is supposed to create this immune response to, like I said, in order to heal, you have to create this inflammatory response where all the parts of the immune system go and attack this virus. Well, when this happens sometimes, and this can happen with any virus, the immune system essentially, in a very simplistic sense, overreacts. Okay. And then it creates this inflammatory cycle that sometimes becomes essentially a negative feedback loop. And this system can create everything from type of autoimmune responses to just continually creating inflammation throughout the body. The second is going to be the autonomic nervous system dysfunction. So this is where a lot of the neurological type of symptoms come into play. One thing we have learned about COVID for quite a while is that the spike proteins tend to start to attack the type of cells that create our barrier system. So it's the systems that create basically the barrier that goes to our gut lining and the same type of system that creates a barrier to our brain. We have what we call a blood brain barrier as well as this gut lining barrier that can be a huge barrier to inflammation to not only our GI tract, and we know when we get things like leaky gut, that inflammation that comes through that leaky gut can create all kind of inflammatory responses. You can start creating food sensitivities. You can start creating reactivity to all types of things. But also, when you get a leaky blood-brain barrier, that can create an inflammatory response on the brain. In fact, some research has shown that people who do QEEG, so basically doing brain mapping of brain waves in the brain, people with long COVID have very similar QEEG findings to those who have had at least mild traumatic brain injuries. So we know that that is creating changes within the nervous system. And then the third is going to be mitochondrial dysfunction. The mitochondrial are a powerhouse of the cells. They create that basic cellular ATP to give us the very basic needs of energy and allow cells to do all the things that they need to do on a regular basis, which is essentially coming down to how your entire body functions. So when we think about this, now we can start getting a good picture of why we have such a variety of symptoms when it comes down to long COVID. I mean, if you have autonomic dysfunction, so your autonomic nervous system, that balance between the fight and flight and the parasympathetic nervous system, which is more of your healing capacity, when that is out of whack, that controls your heart rate and your blood pressure, you can have all these symptoms where you all of a sudden you get up from standing or laying down and your heart rate goes through the roof. A lot of times this ends up being diagnosed as something called POTS, which is basically just showing a functional imbalance in the autonomic nervous system. So understanding those few things are something that is going to be very, very important for you to start understanding why you're having the symptoms that you're having. So now that we kind of know what COVID likes to target and what kind of problematic dysfunction it likes to create, the next thing is obviously what the heck do we do about it? How are we going to assess to know where we need to approach? And I think this is where is well meaning as many doctors are, and trust me, I know lots of medical doctors who are very frustrated with long COVID and definitely want to see patients get better and get back to some normalcy. But you have to be able to have a comprehensive functional assessment, which frankly is just not something that is really within the training of most medical doctors. They're usually trained to identify, diagnose, and then prescribe medication that goes along with that diagnosis. But because of this multi-level dysfunction of different parts of the body, it takes a little bit more of putting puzzle pieces together. So I always say you need to start off with a comprehensive functional assessment that not also looks at the body and inflammation, but is also going to look at how the nervous system is dysfunctioning as well. So when a patient comes into me and into our office and is complaining of long COVID, I'm going to do a neurological assessment. I'm going to look at their vestibular system. I'm going to look, is there any imbalance within that? And there's definitely very easy, just good physical exam tests like Fukuda test or vestibular ocular reflex like VOR test, balance testing that we can do to look at imbalances in that system. And then we can then do something called heart rate variability or HRV testing. Now, a lot of you may be familiar with that, and we've talked about HRV testing on the show before that measures that balance between the fight and flight and parasympathetic nervous system. Now, a lot of you might have HRV on your watch or on an Aura ring or some sort of other functional medical device that are out there, which is great. The problem with some of those testing is they don't measure the balance. And what I mean by that, when we do HRV testing, we'll have a patient lay down and then stand up and then do deep breathing, and that allows us to see how the immune system is responding. So, for instance, with patients with POTS, which I mentioned earlier, when they go from laying to standing, that heart rate will go through the roof. So, if you're just at rest, you may actually show good heart rate variability. But upon standing, we may see that system overreacting. And that is a key feature that we often see in long COVID. So, being able to really get a good functional HRV, I like to talk about, is really important and can give you a bigger, clearer picture. And then you gotta do the right blood work. So you gotta look at inflammatory markers, and the inflammatory markers aren't gonna tell you what to do, but they at least give you a baseline. So things like C-reactive protein, I like high sensitivity C-reactive protein in particular. Homocysteine is a really good inflammatory marker. Maybe you wanna run ESR, that might be another thing to run. Total glutathione can be not an inflammatory marker necessarily, but can tell us if if inflammation is basically overutilizing our antioxidant systems. You also can look at tests like ferritin. Ferritin can be a good inflammatory marker. Maybe you want to measure your spike protein level. So you want to look at the amount of antibodies that you're producing chronically in response to that infection. Because sometimes we have this basically additional viral load. We have little viral proteins that are hanging around from COVID that's basically tricking our immune system into reacting when really they shouldn't be reacting anymore. The infection's gone. We're not sick anymore. So these are all the key tests that I will tend to look at. And then when you look at brain fog and things like that, another test I like to look at a lot is looking at brain mapping, getting an idea of what parts of the brain, because everyone's brains can be affected a little bit differently because we're all differently wired. So all of us are either left brain dominant or right brain dominant. So if we get something that's affecting the nervous system kind of globally, then we may want to know where that imbalance is between the left and right brain and in the nervous system in general. Because when we treat that nervous system, when we try to create that positive neuroplasticity, we want to be able to do it in the weakest areas. So we also create balance. You can do a lot of things to stimulate your brain, but if you're not creating balance within the brain, a lot of times you won't notice any improvement within that system. Okay, so now we've done the testing. Now we kind of have an idea of what is going on specifically. And a lot of these things are really just creating baselines so we can measure improvement objectively. Maybe you have a lot of these things going on already just from how you feel. And now you want to really know is, and I'm sure that's why you probably wanted to tune into this episode of the podcast, is what can I specifically do about it? And there are a host of things. And what I kind of love about post viral syndromes in general is that they actually respond really well to non pharmaceutical interventions. I'm not saying that you may not need some certain medications in the short term. And certainly, if you are on medications to begin with, do not take these recommendations, what I like to do, without consulting with your doctor, because there could be certain interactions with medications, especially things like blood thinners or certain things like SSRIs, antidepressant type medications that might have interactions. So don't do this on a whim. It's always better to work with somebody who knows and can give you guidance on some of these things. Well, the first thing that I'm going to do is I want to get rid of any kind of extra viral load that might be going on the body. And more importantly, I want to stop you from getting sick again. One of the biggest things I cringe on when I'm treating the patient with long COVID is they get COVID again or they get sick again. And nothing is foolproof, but doing something to try to intervene to keep at least a patient from not getting as sick from an infection is going to be very, very important. So we're going to make sure we're optimizing vitamin D levels. I like to get vitamin D levels at least into the 60s for most people. So vitamin D is usually part of my intervention. That's my intervention on most things that involve the immune system, autoimmune disease, etc. And then I'm like to use something called monolaurin. I talked about monolaurin when we did our cold and flu episode, but monolaurin is a compound that comes from coconut oil. It's a very, very good antiviral nutrient that basically keeps the virus from replicating. And so I find this is very successful in long COVID scenarios to help either decrease a viral load, protein load, or at least keep the patient from hopefully getting sick in the near future as I'm treating them. The next thing I'm gonna do is deal with that oxidative stress load. That's where antioxidants come in, and that's really what helps the mitochondrial function. So things like NAC, acetyl L-carnitine, CoQ10 are all really good nutrients to use. And then you also just need those pure, raw nutrients that the body needs for the mitochondria to function, which is really important with B vitamins. Now, B vitamins in of themselves are sometimes a little bit tricky to supplement because a lot of companies, when you go to your typical big box store, are going to have more synthetic type of B vitamins that your body typically is not going to metabolize. It's always good. I really recommend everyone does some sort of epigenetic, some sort of genetic assessment to look at how they metabolize and break these things down. And what's even good in long COVID, the genetic tests we use, that we can actually look at what your weakness is towards oxidative stress. So we can kind of know how important that is to support for you. So that's, a whole different wormhole that we can go down. But that is something that can be very helpful. But for most people, methylized B vitamins are going to be something that your body needs and are the most bioavailable type of B vitamins to get. Now, for some people, they're going to be what we call sensitive to methyl donors. So, for those people, methylized B vitamins may be too much, so they can create anxiety and other issues there. So, at the very least, there is, if you look at especially like B12, if you want to be a little bit safer, hydroxy B12 is a very good form of of B12 that can be easily utilized by the body. And then calcium folinate instead of folic acid is also a good form if you want to be a little more careful and not do those methylized B vitamins off the bat. But if you see folic acid on the label of your nutrient, or if you see cobalamin as your B12, that is almost certainly a synthetic version of that vitamin that at least 60% of the population does not metabolize properly. So either getting a whole food version of that nutrient or a bioavailable version of those nutrients is going to be the best practice there. The next thing that I think is super underrated, and one thing I do, I don't think there's one long COVID patient I haven't done this with, is vagus nerve stimulation. When we talk about that blood brain barrier and that gut lining, that really talks, when that gets disrupted, that really goes into that whole gut brain axis. A lot of people now kind of know about the gut brain axis and how the gut and brain interact together, and it's really connected through one nerve, and that's called the vagus nerve. And we see this when this gets dysregulated, this is, to me, the underlying functional cause of a lot of the autonomic type symptoms that you see, the POTS type symptoms, some of the brain fog type symptoms. And so just doing vagus nerve stimulation can be extreme benefit to these conditions. And that alone, I find, helps a lot of people. So you can do this with a variety of different tools. You know, there are devices out there that do vagus nerve stimulation. Some are better than others, but you can also do this through physical exercises. So you can do this through gargling, for instance. You can do this through deep breathing, and you can do this through humming. Is another thing. So I like to tell, one of my favorite exercises to tell people is to do deep breathing, where you breathe in through your nose, really engage your core muscles when you do that. And as you breathe out, do a low hum as you come out and do that deep breath out through your mouth. And what that does is it slows down your breathing. Some people who have this dysfunction autonomically, when they do deep breathing, they tend to kind of forget how to deep breathe, and they actually do more of a hyperventilation type of pattern where they don't engage that diaphragm properly. So breathing in deeply through your nose, and when you let out, that hum slows that down and creates more of an effective deep breathing. Take an electric toothbrush and put that up to the roof of your mouth near that gag reflex. Don't have to gag yourself, but if you do that near to that area, then that's also going to stimulate your vagus nerve. And you can also do kind of the ice plunge type thing. That is the where you can get into an ice bath, or if you want to do it a little bit more practically, I always say, hey, take your nice hot shower, then turn that temperature down all the way to the cold for, good 30 seconds to a minute, to have that temperature change, which will activate that parasympathetic nervous system. Now, the key is, when you do this, you have to do it repetitively. To create neuroplasticity and create that change in the nervous system, you have to do that over and over again. But with those kind of three techniques, that's something you can work into your nighttime or first thing in the morning routine that can be very practical to stimulate that vagus nerve. My last favorite nutrient for long COVID is going to be proteolytic enzymes. These are enzymes that theoretically can help break down some of those excess spike proteins. They also help with some of the clotting formation that we see happen post COVID. So they also work very well to basically be a cardiovascular support in of themselves. There are several out there. My favorite two to use in practice is nattokinase and serrapeptase, and those can be used very safely and are very effective to help clean up those excess spike proteins. Now, we already talked about how, if you're taking other medications, you do have to be careful so there's no interactions. This one in particular, you definitely, if you're on any blood thinners, make sure you talk to a doctor. We don't want to do anything to thin your blood out too much and have a totally separate issue as far as that goes. So, again, to kind of review of what I like to do the most is, we want to stop any extra viral activity, stop any new infection with things like monolaurin, vitamin D to help regulate the immune system. We really want to support the mitochondria with CoQ10, acetyl L-carnitine, B vitamins that are bioavailable NAC. So if you were suffering from long COVID, I really hope this episode gave you some glimmer of hope, some light at the end of the tunnel, that there are some things that you can do, especially if you've been told there's really nothing to do. Clearly, there are some things to help improve your quality of life and maybe even resolve this long COVID situation. I think it's something that is very treatable, and a lot of people can get some benefit from some relatively easy interventions. So, if you want some help, maybe you've tried some of these things and it hasn't been so successful. But if you want some help, don't hesitate to go to our website, healthytallahassee.com. I'm happy to schedule a consult and talk to you about. I know these can be a complex condition, and I really hope this was helpful information for people at large, where maybe you can help a family member. Don't forget to like and subscribe and follow us at Neurotrition Podcast on Instagram, Facebook, TikTok, and YouTube. And please drop us a comment. Tell me how you like this episode. Tell me about other episodes that you would like for me to go into. And I hope you join us on the next episode of the Neurotrition Podcast.